Removal of multiplanar external fixation. This is an Alizarov multiplanar external fixation frame with half pins and skinny wires utilized for a revisional medial column fusion. There's also a mini rail noted at the lateral aspect of the foot to compress the calcaneal-cuboid joint. This is the removal of the external fixator. I just cut these right up against the frame. Initially, all the skinny wires are cut. It is important if you are using olive wires, which were not used in this external fixator, that the olive wires be pulled out on the olive wire side. Here you can see the wires being cut from the frame. With a large pin cutter. And now we need to loosen these right here with a wrench. No, this one right here, in here. And the half pin clamps are loosened with a wrench. And the half pins are removed under power. The mini rail is removed by loosening the clamps overlying the pins to slide the mini rail off over the top of the pins. Back bolt. No. Back here. Can you get to it? The compression distraction nut is loosened. To allow for easier removal of the frame over the top of the pins. And the mini rail is slid off the pins completely in total. Any loose pins can often be removed by hand, otherwise they must be removed by a power drill as they are threaded.
Do you want to use power to back them out? Power to easy, it's not too big, aren't they?
Once the correct wrenches have been obtained for loosening of the half pin bolts, the half pins will loosen. And this depicts the drill removing the pins from the mini external fixator. And finally, the half pins are removed with a power drill also under chuck and key. These are also threaded bars screwed into the tibia. Once the half pins are completely removed, the frame may be slid over the leg and foot and removed from the operative side completely.
No. Work around them. You can pull them, yeah. Here.
This procedure is done under IV sedation anesthesia.
Here, you can slide the frame off. Just take all the pins.
Now
that are
the
coming
skinny
underneath
pins
the
are
frame and
removed.
Just bend them up or down.
With
so you
care
can
to
slide the
remove
frame
is pull as little
off. You
pin
want those to be straight.
through
You
the
don't hold
skin
them.
as possible.
You understand what I'm saying? Just take the pins so they don't go into the patient's leg. And just either.
You're okay. So it's just getting hung up on the bottom.
Okay.
Once the frame is completely off, all the skinny pins may be removed. As you can see, the wires were cut as close to the skin as possible immediately, so there's very little external wire being pulled through from medial to lateral. This is done with a pin grabber or pin puller. Typically, once all pins are removed, the foot is scrubbed with a hexachlorophene scrub, and a temporary bandage is applied for 2 to 3 days. The patient then may remove the bandage and get their extremity wet with shower or bath. It's not uncommon to have some slight bleeding through the pinhole sites, especially the larger half pins.